A federal judge has temporarily halted the Trump administration's directive for the National Institutes of Health to slash indirect funding for research institutions to 15%. That's a move that could severely impact studies on critical health issues. Joining us right now is Dr. Scott Gottlieb, former FDA commissioner, a CNBC contributor, also on the boards of both Pfizer and Illumina. And Scott, I'm very glad to have you here this morning. There's a lot of information out there, a lot of confusion that's been sown on this. You are someone who served in the Trump administration at the FDA, so I don't think you're going to be coming at this from a political perspective. What does this mean, this stopping of funding potentially to the NIH and the freezing of funding for administrative costs and others at 15%?
Yeah, well, this isn't necessarily a cut in NIH funding. It's a reallocation of how that money gets dispersed. And this relates to a longstanding concern among conservatives. And in fact, the Trump administration tried to do this back in 2017, and it got rolled back when some academic leaders met with the president, and the White House ultimately decided to rescind the policy. But it relates to indirect expenses, so money from grants that are spent on things like overhead or administrative costs by universities. Universities charge a certain fixed percentage, depending on what the institution is and how high their costs are, directly on top of research funding. So let's say a university gets $100 in funding for research from the NIH. If a university has an indirect cost of 50%, they'll charge $50 on top of that $100 to help fund things like their buildings, legal costs, compliance costs. And the perception was that this money is being skimmed off of NIH research funding that could be going directly to research projects to help support sometimes bloated infrastructure of universities. That would be the argument of conservatives who have been trying to roll this back for years. And so if, in fact, this does go through, and I think some form of this will probably get enacted, this announcement that the NIH made or the administration made probably will get rolled back. It seems to conflict with existing law that prevents them from doing this, passed in 2024 as part of a budget bill. But I think after this is resolved in the courts, some policy will go forward that starts to sand down these indirect costs from the NIH funding. And presumably there would be more funding freed up from that would go directly to research projects and directly to other expenses that fund scientific research and not support the infrastructure universities. And the universities themselves will have to find other ways to support that.
By the way, the universities do this with private donors as well. I believe it's generally around 15 to 20%. I think it's 20% is more the average. I think with NIH funding, from what I've read, it averages out around 40%. And I think that's where conservatives feel the issue is, like, it's not fair to government to be picking up more of the overhead than you would expect from private donors. What else is happening just in terms of what DOJ's efforts are, looking to cut back, looking to trim, potentially even shut down other departments? What have you heard from people who are working in the FDA, who you used to work with? What about other departments as well, like the CDC?
Yeah, well, this policy related to the NIH does appear to have come from DOJ and probably from OMB. I'm not sure that all the policy people in the White House were briefed in on it. And that's another reason why it may get temporarily rolled back. Again, I think some caps are going to be put in place on indirect costs and probably some allocation for higher costs versus lower costs part of the country. You don't want to create a cap that's so low that you can't do research in an urban setting, for example, where the overhead costs just are higher. I'm hearing that there's going to be some cuts made to broader health agencies, perhaps the FDA. I hope they're going to be judicious how they think about doing any kinds of reductions at the FDA, given the agency's very important mission, but also CDC. I think CDC is far more vulnerable to cuts and the kinds of things that we saw happen to USAID, because a lot of the money that CDC disperses are really pass-through grants that are given to local public health departments for different kinds of programs. And when you go through those grants, you can find some things that sound silly on the face of it. And so I think it's going to provide a lot of fodder for people who want to make cuts to those grants, skinny down the agency, and point out that some of the grants may have been going to things that don't seem like high-value use of dollars. In the same way, I think there's been an objectification of USAID. So I would say that CDC is probably the most vulnerable right now. You have to differentiate from agencies that spend the money inside the agency to administer important services, and I would put FDA in that bucket. FDA regulates the blood supply, they regulate livestock feed, they regulate pet food, They regulate the entire food supply, leafy green vegetables. The money gets spent inside FDA to fund regulatory programs that people find important versus agencies like the CDC, where a lot of the money is spent on grants that are pass-through grants given to local public health agencies. And that makes them, I think, more vulnerable to cuts. And there are rumors and discussions that there's going to be some announcement imminently from DOJ about cuts to public health agencies. Perhaps they're waiting till after RFK's vote to make sure that he gets through the Senate so they don't encumber that.
You're a conservative, you're a Republican. How do you feel about the cuts that are laid out? You were pretty clinical in your discussion of it. There are going to be things they find that look wasteful on the face of it. What do you think about the idea of cutting those agencies?
Yeah, look, I think the better approach is to get strong leadership in these agencies and start to reform the agencies from within and reprogram some of that money rather than administer wholesale cuts that will take out some things that perhaps were excessive, but also going to hit programs that probably were very important. And I think we're seeing that debate play out with USAID. There were a lot of things that they were doing that they probably shouldn't have been doing. There were a lot of things that they were doing that really are critical to global public health. And the same thing is going to be true of CDC. And so I think if the administration took more time, got their leadership in place, and started to try to reform these programs and recommend where the cuts should fall, that would be a far more efficient process. It would take longer. It'd be probably less immediately satisfying. But I think in the long run, it would lead to less consternation, fewer court challenges, certainly, and probably more of a deliberate approach to taking out the bad programs and not throwing the baby out with the bathwater, so to speak. Perhaps they're going to back into that because they're going to get some pushback from the courts and others with respect to these wholesale cuts, so they will back into a more deliberate approach. I'll tell you, when I got to FDA, there were a lot of grants that we gave that were probably an inefficient use of resources, and we were able to reprogram a lot of that money. It took time, but we were able to make a lot of reforms to how we dispersed money, and I would hope that's what they settle into through this process.
Scott, let me ask you quickly, avian flu, this measles outbreak in Texas, and then the regular flu season. How are we doing on all these fronts?
The measles outbreak in Texas, hopefully they will get control of. This is an outbreak in an isolated community that had particularly low vaccination rates because of religious exemptions that community secured. Texas overall has high vaccination rates for measles, mumps, and rubella, probably about 94%. Used to be 97%. It came down, but they're still high and they're still well above the national average. With respect to flu season, we're having a spike in flu post-holidays that's pretty severe, probably the worst flu season that we've seen since 2002. It appears to be H1N1 and H3N2, so a mix of both of those, split largely evenly. The vaccine does seem to be protective. The flu vaccine seems to be more protective against H1N1. This is not H5N2. It's not bird flu. The public health labs across the country sequenced about 3,500 individual cases from patients over the course of the last week and didn't find a single case of H5N2. And so this is probably just seasonal flu that's having a second spike, and a pretty severe spike. Hospitalizations are starting to go up. In New York City, for example, where it's particularly bad, as much as 30% of all visits to doctors' offices are for influenza-like illness. And so New York City is probably the highest right now in terms of a local region around the country. But the national average is about 8%. In the South, it's about 10%. So that's quite high for this time of the year. So we are having a pretty bad flu season, a second spike in flu right now.